Hi there, my name's Justine Sims. I'm currently a registered nurse at a hospital in Bloomington Normal, Illinois, where I work in labor and delivery and occasionally postpartum as we're an LDRP unit. We do approximately 130 to 140 births per month. I'm also employed at one of only 2 freestanding birth centers in the state of Illinois. At this CABC accredited independent birth center, we offer healthy women holistic family-centered care for birth, breastfeeding, educational programs, as well as primary obstetric and gynecological care in a home-like setting. So this center offers water birth too, which is unique to my area as none of the hospitals offer water birth in the surrounding areas. So we do anywhere from like 7 to 20 births a month at the birth center. I'm specifically interested in midwifery care in a birth center setting, but I also enjoy the idea of bringing midwifery care into the hospital, and I'm intrigued to learn more about the home birth process as well. So really my area of practice of interest is still growing. My love for caring for women throughout the lifespan began in nursing school. I had the opportunity and privilege of being present at my cousin's birth, and she was also a nurse, so she invited me to come because she knew I was in nursing school. So immediately I fell in love with the physiological process, but as well as the connection that comes with women supporting women. So I started my nursing career in L&D with the eventual goal of always becoming a certified nurse midwife. So this was the second time I had the pleasure of watching the business of being born, and both times I was struck with an overwhelming sense of desire to be better. In an advanced country such as the United States, it seems that we should be doing better. Birth has become such a medical process that has significantly strayed from evidence-based practice, and we've allowed birth to nearly become a disease process that needs routine medical intervention rather than treating it as the amazing physiological process that it is. As they stated in the business of being born, a lot of the medical professionals that are participating in birth care, such as doctors, have never actually been a part of normal birth experience. That's something I really never thought about before, is that their training is significantly different than the training of a midwife or even that of a nurse. So it's something I just really never thought about. And I feel like a large part of the problems that are, a large part of our problem is that evidence-based care is being lost to traditional medical training. Of course, medical intervention is a wonderful thing that can save lives, and no one can debate that. But where is normal physiological birth gone? And why aren't we teaching it? Why aren't we researching it more? And why aren't we following the research that's already there? I'm just wondering what you guys think barriers are to that. Like, why are we not looking for that evidence more? And why aren't we using the evidence that we have? Birth by numbers, that video only magnified the need for this change. The video illustrates the need for the change, and it shows the statistical and analytical reasoning of why this has to change. It's the why behind it. And these statistics provide the evidence that really should be driving this culture change. The numbers don't lie. And we have to achieve better. We just have to. In our country and also as medical practitioners, we have to be better. I plan to use this information, and not to mention the gusto that I feel when watching these types of videos, just really gets you riled up. But I plan to use this information to drive my practice and so I can be a part of the force driving this change in the birth arena. In response to the questions about various places to birth, I really support all places of birth. I think that it is important to have valuable, reliable evidence about labor and birth, and then share this information with women and their families to educate them and then support their choices, whether you agree with them or not, so that they can make informed decisions about where and how they want to bring their child into this world with their body. My personal experience and perception of hospital birth is that there are so many interventions and procedures pressed upon women by staff who just don't understand how to birth in any other way than what they were taught. However, I also have experienced when women and their families are supported in their informed decisions and they're with an educated staff and practitioners who are aware of evidence-based care, when those two things collaborate together, a hospital birth can be a beautiful thing. It really can. It doesn't have to be bad. But my most recent and fulfilling experiences have been with birth center births. After most of my experiences had been fighting birth culture in a hospital setting, which if you've worked in L&D and you know what culture I'm talking about. But then anyways, going to work in a birth center was totally different. And working in a place where they truly support healthy women reaching birth at its highest potential, it was like a breath of fresh air. These births, in my opinion, are what an evidence-based patient approach birth should really look like. And I hope to always facilitate and support this type of birth that I've seen in my future practice, regardless of where that birth occurs. I must admit, home birth is not something that I have experienced or been a part of. It is my goal to immerse myself in home birth practice at some point to learn more about it and kind of see what that looks like. Although home birth does make me a little apprehensive after experiencing what kind of obstetric emergencies can occur and knowing, not knowing that much about home birth, not having experience with it, it does make me a little apprehensive. Is there anyone else out there who shares this apprehension after working in OB and thinking about home birth and not having that safeguard of being able to rush back to the OR or, whatever it may be? How did you overcome that if you have? How have you overcome those apprehensions? However, I'm still not opposed to healthy, low-risk women birthing at home, even though I have my own apprehensions. As I believe just as choosing to die at home is a right, I believe birthing at home is also the right of informed women and their families, and that's really their choice to make. Before deciding if I could do home birth practice, I think I would need to have more experience in this area, and also I want to do more research and learn more about it, be a part of it, before I could decide that. And that's it. So thank you for listening, and I look forward to hearing your feedback. Thanks, guys.